As Nigeria enters the peak of the rainy season, health officials are sounding the alarm over a silent but deadly threat, cholera. While the showers bring relief from the scorching heat, they also flood poorly drained areas, turning them into breeding grounds for waterborne diseases. With over 1,200 flood-prone communities now on high alert, the Nigeria Center for Disease Control and Prevention (Ncdc) has warned of a surge in cholera cases. So far, 1,307 suspected cases and 34 deaths have been recorded across 30 states, prompting a swift response from the Ncdc, which has begun nationwide preparedness workshops and stocked medical supplies in vulnerable zones. Director General of the Ncdc, Dr. Idrìs, attributed the spike to poor sanitation and worsening floods. He urged Nigerians to take urgent precautions, boil drinking water, prioritize hygiene, and seek immediate care when symptoms arise.
Cholera is a food and waterborne disease caused by the ingestion of this organism in contaminated water and food. Water is usually contaminated by the feces of infected individuals. Contamination of drinking water can occur at the source, during transportation, or during storage at home. Food may be contaminated by soiled hands, either during preparation or while eating. Beverages prepared with contaminated water and sold by street vendors, especially contaminated ice, or even commercial bottled water, have been implicated as vehicles of transmission, as have cooked vegetables and fruits freshened with untreated wastewater. In some cases, these people prepare vegetables and all, they say wash. What they used to wash are not good water, not treated water. The time between infection and appearance of symptoms, this is what they call incubation period, is 2 hours to 5 days. It has a higher risk of transmission in areas that lack adequate sanitation facilities and or a regular supply of clean water. Unsafe practices such as improper disposal of refuse and open defecation endanger the safety of water used for drinking and personal use. People most at risk are people of all ages, living in places with limited access to clean water, the people living in areas with poor sanitation and poor hygiene, people living in urban slums where basic water and sanitation infrastructure is missing, people living in rural areas who depend on surface water or unsafe pipe or borehole well water sources for drinking, people who consume potentially contaminated food or fruits without washing and cooking properly, and people who do not perform hand hygiene at appropriate times. Man-made or natural disasters like flood, resulting in population movements and overcrowded refugee camps, cholera situations occur frequently there. The relatives who care for sick people with cholera at home, healthcare workers including doctors, nurses, laboratory scientists, etc., and other health workers who provide direct patient care in the absence of standard precautions. What are the symptoms of cholera? These include the acute, profuse, painful, watery diarrhea, which we normally describe as characteristic rice water stool. The kind of stool, if you look at the stool they release, it looks like rice water. When you are boiling rice and you sieve the water, that's what it looks like. Several cases can lead to death within hours due to dehydration. That's what kills in cholera. These people lose a lot of fluids all within a short time and they go into shock. That's massive blood fluid loss. However, most infected people, about 80%, may only show mild symptoms or have no symptoms at all. Cholera treatment. This disease is easily treatable if detected early. Most infected people can be treated successfully through prompt administration of oral rehydration solutions to replace lost fluids and electrolytes, and occasionally appropriate antibiotics. The oral solution is a powder that can be reconstituted in boiled or bottled water. Cholera can be deadly when infected people do not have access to care immediately. Cholera can be prevented through ensuring access to safe, potable drinking water, proper sanitation and waste disposal, appropriate hand hygiene, including hand washing, raw fruits and vegetables, or food from street vendors and raw or undercooked seafood should be avoided.
Despite this troubling trend, there is a glimmer of hope as the Ncdc reports a sharp drop in Lassa fever cases from 41 to just 10 in the past month, thanks to intensified surveillance and community engagement. Meningitis cases are also declining, with vaccination campaigns and rapid response teams helping to keep the disease in check. On Mpox, Dr. Idrìs noted 723 suspected cases this year, with 3 confirmed fatalities. He reaffirmed that the agency's containment protocols remain robust.
Ncdc continues to advocate to state government to prioritize action for solutions that ensure access to and use of safe water, basic sanitation, and proper hygiene practices in communities. Specifically, we advise the activation of their emergency preparedness plans to address enhanced surveillance efforts, potential flooding and displacement events, mosquito control efforts, that is elimination of breeding sites, and establishment of cholera treatment centers or ORT centers. While we mention mosquito, during rainy season or flooding areas, apart from increase in diarrhea cases, especially cholera, we also see increases in malaria, yellow fever, and dengue fever. Why? Because mosquitoes who carry this disease breed inside water. When you have rain, you have water accumulating in some vesicle around the homes, or in gutters or drainage systems that are not draining. If you look at those drainage systems, you see mosquito larvae. That's during drainage, their numbers are increased. And once they increase, the chances are that they bite more people. Malaria, yellow fever, and dengue fever can increase. That's why, again, these are also diseases linked to rainy season or flood. So we advise state governments again to urgently constitute their rapid response teams. Consider vaccination campaigns, especially those of those diseases that are vaccine preventable, like yellow fever. Check sewage and drainage systems. The reason why we're saying this is that when it rains, runoff water, surface runoff water goes into this drainage system and sewage system. If they don't drain anywhere, they mix with all these feces of water that the people defecated, and that's where again these cholera cases increase, especially in those slum areas where you have proper water supply. And we urge again state government again in preparedness to provide provision of water, like water tankers, treatment of rehabilitation of boreholes, and provide emergency toilets or latrines where necessary. These are things that state government must prepare for some of these, especially as the rains are here.
The Ncdc continues to stress the importance of early treatment, public awareness, and transparent reporting in the fight against infectious diseases.